In the past, this course has attracted yoga teachers, mindfulness teachers, other kinds of mind-body therapists who are interested in taking those practices into work with people who are living with limiting illness. So they may not already be working with these clients or these patients, but they would like to, and they would like to develop skills to do so, the confidence and skills to do so. And then the second group of people who come, and they integrate really nicely because they learn from each other on the course. The second group of people are people already working in palliative care context. So that might be, again, therapists, complementary therapists, it might be chaplains, it might be nurses, occupational therapists, allied health professionals, even doctors we've had, who are yoga practitioners or mindfulness practitioners who they use the practice in their own life. It's part of their life. They're not necessarily yoga teachers as well, although they might be. But they want the confidence and skills to start to bring some of that practice that they find so helpful in their own life, their personal life, into their clinical work. So there are those sort of two broad groups, and during the course we share our experiences, and we go into small groups, and so people really do learn from each other and share their experiences and their stories of using yoga and the specific sort of techniques and different practices in yoga to help their patients, and also to support family caregivers, which is a big part of this. So palliative care is about the unit of care. It's not just about the person who is living with that illness themselves. It's about their carers, their partners, their kids, or if they're, sometimes it's parents who are caring for a dying child. And I also cover bereavement. So sometimes we have actually bereavement professionals, counsellors coming to the course. So how can we use these skills, the self-regulating skills from yoga to support people in their bereavement as well? Because it's a kind of, palliative care covers that from diagnosis through death and into bereavement. That's what I'm covering. So we also have people coming to the course who are currently supporting someone in their personal life who is living with a life-threatening illness. So, somebody might be supporting a parent who is living with perhaps a cancer or a non-malignant disease, another family member, and they just want to gather some skills to help that person and to help themselves, to resource themselves to support that person and that family. People will leave the course with a broad understanding of palliative care. So most people, when they think about palliative care, they think about death. They think about the days before death. And that's actually not what palliative care is. Palliative care is an approach, it's a philosophy, and it aligns beautifully with the philosophy of yoga. So it accepts death as a normal part of life, and it is about enhancing the quality of life for people living with life-limiting illness up to death. And that includes, as I said before, their families and their caregivers. So they will understand more about what palliative care is, and they will also learn about what normal dying looks like. I mean, people don't really know what dying looks like because we're so protected from it in our technological age. Death is normally in hospital. That's still where most people die. So I want to sort of demystify dying and to think about, to bring a little bit, I'm not a medic, but to bring some of the training that I've had in palliative care. So I have a palliative care training, to sort of help people to understand a little bit more about, what dying might look like, what might happen, and how we might support those very natural processes using things like breath work, meditation, how to relax the body. If people have different, specific conditions, there might be specific movements, asana, or practices that we can use with those specific conditions. So, looking at aspects such as chronic pain, or breathlessness is a big one of mine. I'm very interested in breathlessness, fatigue, and also the normal stress and anxiety that living with a life limiting illness brings. So people are living with a greater or lesser existential dread. And I think yoga is so powerful for that, because the goal of yoga is to really to see things as they really are. So it really invites us to acknowledge the reality of birth and death. So, when we're bringing the philosophy of yoga into palliative care, which was actually originally a sort of Christian philosophy. So the woman who set it up, Dame Cicely Saunders, was a staunch Christian. So I'm bringing those two philosophies together. If you're a health professional, an allied professional, a psychologist, somebody who is working within that context of a medical setting or a care home, you have to work within certain boundaries. You have your job to do, you have your clinical tasks. And I think what's really subtle about this course, and what I hope will help you with, is to have the confidence to use some of the embodied skills from yoga when you are facing the inevitably difficult circumstances in which you find yourself with somebody who is in distress. So distress is really hard to manage medically. There are obviously sedatives, there are obviously powerful painkillers. This is absolutely can align with and complement the medical model. But I think the feedback from previous courses is that this course enables people to feel more confident to use their humanity, their body, their breath, their whole being, to support people who are distressed. And that is something that you can build on, right from day one.